I am Dr. Hardik Morzaria, and I am from Vadodara, Gujarat. I am connected with the medical profession since 15 years, and my specialty is anesthesiology and critical care consultant. Yes, I must say that communication skill is the most undermined skill nowadays, as we observe around us, because we gone through how much efforts it takes to be acquainted with a good communication skill. And yes, it is very much misunderstood with the speaking, because speaking is a very effortless thing and it's a one-sided thing. It's just the expression of ourselves. Whereas communication skills is a bilateral thing, and it requires to understand others emotionally and of course the logical what they want to convey the message, and of course it involves the listening skills also. So yes, it improves our professionalism also. It improves our success rate in our respected professions also. And overall, I must say it improves our own quality of life. That is very, very important. How I am improving? Yes, I am going through the reading habits more and more. Since 2 years, I am with DNA platform. And from there, I got the guidance lot and lot. And apart from reading the medical literature, I am going through the non-academic books also. And yes, as I said, exposure therapy that is being provided in DNA platform, that also plays a huge role. Exposure therapy, a bit in a way I want to express that every day I expose myself for at least 1 hour speaking in this platform. I would consider this as a divine platform, and we are being into the breakouts room and we expose ourselves to any of the topics. I usually take it extempore topics nowadays, since I have been here since a long time. So yes, it is helping me a lot. Yeah. Regarding Saturday session, those are my favorite sessions. Those are very practical oriented, real-time life examples that we usually go through are being reflected in those sessions. And yes, and you connect it very nicely with the stories also, and with the real-time examples, you connect it. So it becomes very much relevant to us also that yes, the and of course, I know you come from the school of hard knocks, so you have gone through so many of the life experiences, and those you compile it and put it in a platter so that others can use it to the best in their lifetime. So yes, definitely these are life-changing sessions, I must say. Yeah. We need to understand the feelings of the patients on the other side. We need to keep ourselves in their shoes and understand the situation, understand the holistic approach. As I said, being into the ICU, being with the ICU patients and OT patients, we need to communicate with their relatives on a day-to-day basis. Usually, these patients are in a physical agony whenever they come to, and get admitted in the hospitals. Along with that, they are usually mentally tormented also. And usually they are in financial crisis also sometimes. And apart from that, adding a fuel to the fire, nowadays, since in a good times, most of are preferring to be in a nuclear family structure. So they are not that much emotionally networked also during such testing times. So it becomes imperative for the medical professionals to think from the holistic approach how we can improvise their mental state. So we need to extend our, we need to understand their situation. We need to have the overall holistic approach so that they can able to manage all the situations from emotional point of view. Of course, apart from that, physical agony also they are going through, and communication skills plays a important role while breaking the bad news also. As I said, we need to emotionally connect also with them. So we need to disclose such news in a staggered way. Days are gone that we cannot just go and yes, this is what happened, and this was the fate. And just we cannot declare the bad news. We should not do that if we understand the emotional point of view. So yes, overall, I can say good communication skill helps to garnish the overall conduct of the medical professionals. Communication skills being the external one. Apart from that, I am improving my internal talk also. That is also known as self-talk. Very much mentally sorted. It has made I am most of the time in a mental peace. So yes, apart from justifying the medical profession, I am justifying my own life also actually.
I am Dr. Jalendra Baravkar, currently working at AIMS Bhopal as a SR senior resident. So the first thing that I gained from this working on the English communication skills after joining DNA is the confidence. Okay, which was very low in before joining it, and after joining it, I was observing that my confidence is increasing day by day. Specifically after joining this institute, yeah, here most of the my colleagues, they are from the you can say they are from convent medium, and most of them are from South India. So mostly they know only two languages, their own language and the English. Okay, so I have to communicate in English. Okay, so initially it was quite hesitant for me to talk with them in English. But after joining class, I was getting better and better, and very close colleagues of mine, they have told me that Dr. Jalinder, you are improving, your English is improving, because I was sharing my experiences with them, that my English was very poor before the joining this institute. And please let me know, please give me feedback whether I am improving or not improving, so that I will work on it. Okay, so they are giving the honest feedback that you are improving. I can see clearly the change in my teaching to the medical students because of the English communication. And second thing is, even I also tried to moderate the sessions after joining the DNA Academy. It's important that you should understand how your thoughts are flowed. They are how they are flowing. Okay, then when you are aware about your thoughts, so whether as you said in one of your lecture, that your thoughts doesn't mean that it's your personality. Okay, okay, so that you have to observe your thoughts. Sometimes they come unnaturally, or you can say they are just flowing, or they are just coming. Okay, so first understanding the thoughts, it is very important thing. Then the Saturday sessions that help me about, for example, whenever you go to some uh, 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 any death event or etc., at that time how to talk. Okay, that helped me a lot. Okay, these type of things that you cover in your Saturday sessions about the even the some neurological behaviors, or the neurological things from our medical science. Okay, that helped me a lot in my career. Most of the times, what is important, that there is a situation, for example emergency. Okay, so in that situation, the patients and their relatives, they are already panic. Okay, in that situation, communicating your things appropriately in a, very specific manner, for example breaking bad news. Okay, so all these things, I am working on it, and I am getting it better day by day, I think. And DNA has helped me a lot in all these things. Then while speaking about the working with the patients and with my colleagues, so this thing helps me a lot. Okay, because when it's not about only English communication, it's about the communication. Okay, when I have to convey some important information, okay, to the patient. I need to be have that sympathy, empathy about the patient. Okay, I have I should have knowledge about the social demographic characteristics. Specifically, I work in community medicine, so I must aware about the things which are related with their socio-demographic characteristics, so that I will be able to give them the appropriate information. I should help them in decision making.
Yes, my name is Dr. Chandrasekhar Haine. I'm a psychiatrist running 90-bedded de-addiction and rehab center in Mirror, practicing since last 15 years. Um, Actually, I have joined the DNA platform because as I'm practicing since last 10-15 years, but I was means less confident in attending like webinar, seminar, or conferences. But I am with you, sir, since last 2.5 months. So gradually, I am observing changes in myself. Like I started attending webinars, seminars also, and usually I used to avoid chairing sessions also, chair as a chairperson or co-chairperson also. So last time changes like I started attending like conferences also and SIPs I attended. I usually I was invited as in one session as a co-chair person. So usually immediately I said yes that time. So that was my change. Also, my view towards English has also changed. Like I used to avoid listening also. Like I used to change my language, like used to go to Hindi instead of watching English. So nowadays I am avoiding all Hindi or Marathi stuff. I usually subscribing any whatever English language is there in any topic. So I am opting this English language. So this is a change what I have observed since last 2.5 months. Sir, what I found is though we are psychiatrists, we are trained in pathology of psychiatric illnesses. No, but what I found is like uh, your topics like related to self-esteem, self-awareness, self-regulation, and these things are helpful for development of EQ, emotional quotient. So as we say, for successful any to become a successful person, intelligent quotient will not help because it plays only 25% role, but EQ plays 75% role. So your session, I think they are helpful in developing emotional quotient also, like self awareness, self regulation, self-esteem, motivation, soft skill. These are usually your topics are related with this area. So I think it helps in improvement in emotional quotient also. And as we say, prevention is better than cure. So in here also, it plays major role. Your session are helpful in preventing these psychiatric illnesses. And as we know nowadays, depression, anxiety, phobia are these are emerging psychiatric illnesses. So your topics are related with this. So it helps in EQ, development of EQ. So morning sessions are helpful, really helpful, sir.
I'm working on my communication skills since last 2 years. I have joined Sandeep Patil's batch. It was around 2 years back. Then and before that, what was happening? Many times in my mind, there was things that there were some things which were bothering me. Like I was thinking that if I speak to someone, that person will judge me, or I will make mistakes. So such type of things were there, and many times I was not able to express myself. But after joining the class, that fear was not there, and I never. Again, I started working on myself, like habits. My habits are changed. I have started reading, then listening to the podcast, and many things have been changed. I started working on myself. So many things have been changed after joining the DNA class. But after listening you, I'm observing changes in myself, even my behavior with my staff, even with my patient. It has been improved more. So I am observing changes in myself. My there is no hurry in doing anything. I quietly listen to the patient. And when it comes to the psychology, we must understand the thought process, we must understand the emotions, we must understand the behavior. And you are focusing on all these things. You have covered the very interesting topics like parenting was there, digital distraction was there, happiness was there, self-esteem was there, then worry was there, acceptance was there. Very nice topics, sir. And even those people who are from other professions, and they they are getting more benefited from these topics, because we are not having knowledge about these issues. Like you have mentioned in that compassion, empathy is there. Understanding the other people's emotion, that is the important thing. Putting yourself into that person's shoes, that is the important thing. Even in case of communication, empathy is required. When you feel that that person is going through such type of emotions, and I should understand that person in emotions. When you put yourself into that into his shoes, then you will be able to understand that person's problem. So really very nice topics are covered by you in that Saturday sessions. Really helpful to anyone. Yeah.